Hello, my name is Shawn Horwitz, and I'm a general surgeon at Murfreesboro Medical Clinic, and I am with the Comprehensive Breast Center. Typically what happens is a woman comes in for their screening mammogram and they see an abnormality. And typically you either get a call back, or either your GYN or your PCP will actually talk to you and be like, we found this abnormality, you need to come in and get extra imaging. And then you actually get extra imaging, something called a diagnostic mammogram, and then usually an ultrasound as well. And that'll kind of tell us for sure if there's something worrisome or not that typically does need a biopsy. So everyone processes the information of breast cancer differently. And I've seen the entire gamut of emotional responses. And we, and me in particular, handle this differently in terms of how you comfort someone. It's different, to be honest. Some women are just very straightforward. They want to know the facts and they're ready to move on to the next steps of treatment and just go. And some women are very emotional, and the most important thing I stress with them is we're not going to abandon you. We will be with you every step of the way. It is a process. It definitely is a marathon and not a sprint, and there are different steps that we have to take to get you through it. But I stress that most women, we catch this early enough, and breast cancer is curable if you get it taken care of at an early stage. And that, of course, goes back to why screening mammograms are critically important and doing your self-breast exams. In general, if we can do surgery, there's two main avenues, kind of two forks in the road. One would be to do something called a lumpectomy, or breast conserving therapy. And that means that that you would actually keep your breast. And we go in there, remove the tumor itself completely, and then you would need a follow-up with radiation. And the other fork in the road is doing a mastectomy. And that means that the entire breast is removed in surgery. And you have the option of removing both breasts, and even the option of getting reconstruction on both sides. And women always ask, is that included and would be covered by insurance? And the answer is yes, because that is a reconstructive process and not a cosmetic process. So that is included, but I get that question all the time. Sometimes, if it's a very aggressive or concerning tumor, we actually send you to oncology first to discuss actual chemotherapy, and sometimes that's actually given before the surgery itself. So it changes from patient to patient, and it is very patient unique in terms of the treatment that you get. Thankfully, I don't have a family member that has breast cancer, but my mom always comes to mind, of course, and the reason for that is from a young age she always stressed to be as proactive as possible with your health, whether it was going to your dentist or seeing your regular doctor, or basically doing everything that doctors suggest to keep you as safe as possible. So she stressed that, and I always think about that with women. I ask every patient, no matter if I'm doing their gallbladder surgery or whatever I need to do to them, have you had your screening mammogram? Every single one. That is critically important, and I always remember my mom telling me that. And there's many times where I've had patients say, I haven't had my mammogram for 5 years or 10 years or however long, and we get it done and we find something, and I've even caught early breast cancer that way. So, that it would always, of course, be my mom. I'm Dr. Shawn Horwitz with the Comprehensive Breast Center. Your breast health is our mission.